For the case presentation and patient profile, our patient's age is 34 years old, gender is female, occupation is food service worker, and location is in the suburban area. So for the first day, the patient presents with mild flu-like symptoms, including fever, muscle aches, and mild gastrointestinal discomfort. She attributes these symptoms to a mild viral infection. For the third day, symptoms persist and worsen, with the patient experiencing severe headache, stiff neck, and confusion and loss of balance. She decides to visit her primary care physician. The patient reports consuming several high-risk foods in the past week, including deli meats, unpasteurized cheese, and prepackaged salads. She is also in her second trimester of pregnancy. There is no recent travel history or known exposure to sick individuals. So for the clinical examination, physical examination reveals fever, nuchal rigidity, and neurological symptoms such as confusion and unsteady gait. Laboratory tests, blood tests, complete blood count showing elevated white blood cell count, blood culture positive for the bacteria. Lumbar puncture, cerebrospinal fluid analysis shows elevated white blood cell count, increased protein, and normal glucose levels. CSF culture positive for the bacteria. For the imaging techniques, MRI of the brain to rule out other causes of neurological symptoms and assess for any kinds of brain involvement. The case study assigned to our group presented signs and symptoms of Listeria monocytogenes meningitis or Listeriosis. For the case definition, Listeria monocytogenes meningitis or Listeriosis is a bacterial infection characterized by the inflammation of the meninges caused by the bacterium Listeria monocytogenes. So its signs and symptoms are as follows. Its early symptoms include mild flu-like symptoms such as fever and muscle aches, and mild gastrointestinal discomfort. Its progressive symptoms are severe headache, stiff neck or nuchal rigidity, confusion, altered mental status, and loss of balance or coordination. For the other signs and symptoms that may also happen, nausea, vomiting, or insensitivity to light or photophobia. So for the clinical and public health history, the population at risk. Pregnant women face a substantially elevated risk, which is 10 times higher compared to the rest of the population, of acquiring Listeria monocytogenes meningitis. Furthermore, the condition primarily affects infants, immunocompromised individuals, and older adults aged 65 or older. For the epidemics and outbreaks reported in the Philippines, at present, instances of Listeria monocytogenes meningitis are relatively uncommon in the Philippines, unlike Neisseria meningitidis or meningococcus. So infections, diseases, or syndromes similar to Listeria monocytogenes meningitis. So take into account additional pathogenic entities that can also result in meningitis, such as the herpes simplex virus, Neisseria meningitidis, and Streptococcus pneumoniae. Differentiating between viral and bacterial origins can be aided by a lumbar puncture. The majority of bacterial meningitis cases have elevated polymorphonuclear leukocyte counts. So the differentials are as follows: influenza virus infection, strep pharyngitis, migraine headache, tension headache, cluster headache, subarachnoid hemorrhage, acute otitis media, subdural hematoma, epidural hematoma, mononucleosis, and intracranial mass or tumor. So for the diagnostic tool or procedure to identify the infection, disease, or syndrome, Listeria monocytogenes is difficult to isolate. However, a procedure called code enrichment can be used to diagnose the infection. The specimen is exposed to a temperature as low as 4 degrees Celsius and is placed in the media. This procedure could take up to 4 weeks. Additionally, methods like rapid diagnostic tests, ELISA, immunofluorescence, and nucleic acid sequencing technologies are also used to diagnose the infection. So the culture-based methods used to diagnose the disease are as follows: blood culture and the cerebrospinal fluid culture. Both of these are used for detecting Listeria monocytogenes, or the pathogen of the disease. The risk factors associated with the infection, disease, or syndrome are as follows: immunocompromised individuals, organ transplant recipients, hemodialysis patients, corticosteroids or cytotoxic drug recipients, alcoholic patients, liver disease patients, pregnant women, and newborn infants. The gold standard diagnosis or the drug of choice for this disease is the intravenous ampicillin, often in combination with gentamicin. So ampicillin is effective against Listeria monocytogenes by inhibiting the cell wall synthesis. As for the gentamicin, it is often used in combination with ampicillin for its synergistic effects, especially in severe cases or in immunocompromised patients. So the demography or the prevalence and incidence of the disease in the Philippines, as of this date, listeriosis is an uncommon occurrence in the Philippines. There are no demographic reports available with relation to the bacterial infection. However, it is important to note that the infection is a serious case that can harm a wide range of population. For the mortality and morbidity reports, as cases of listeriosis are extremely uncommon in the Philippines, there are no noted morbidity or mortality cases available for research. The levels of interventions applicable for the disease: for the primordial intervention, addressing risk factors by promoting food safety practices by thoroughly washing and cooking foods, storing foods properly, and washing hands appropriately. The primary intervention: avoid unpasteurized dairy products. Secondary prevention: early detection and proper treatment of Listeria monocytogenes to minimize complications to avoid transmission to the fetus. Antibiotics commonly used are ampicillin and gentamicin. For the tertiary prevention, minimizing long-term impacts and complications by providing support care, monitoring individuals, and rehabilitation. So the following are the references used for our presentation, and we thank you for listening to our report. We are group number 8 from 1NU03.